By way of introduction, I want to read something from a fabulous book by Amy Sherman called Kingdom Calling. It's about vocational ministry, and she makes a really good point that we spend the bulk of our days, the bulk of our lives at work. And so if our work is in fact also our ministry, and not necessarily in the professional sense that Alan does, or someone working in a nonprofit Christian organization, but in fact, for example, maybe as a doctor or a teacher, that we are able to use the work that God has given us as missionaries in Richmond through our vocation. And I wanted to read this. This will sound very familiar because Sherman actually is quoting Tim Keller in Generous Justice, so it should sound familiar to you. From Proverbs 11:10, when the righteous prosper, the city rejoices. Keller explained that the righteous are the just, the people who follow God's heart and ways, and who see everything they have as gifts from God to be stewarded for His purposes. Keller wrote, the righteous in the book of Proverbs are by definition those who are willing to disadvantage themselves for the community, while the wicked are those who put their own economic, social, and personal needs ahead of the needs of the community. This definition of the righteous is what makes the verse sensible, otherwise it would be counterintuitive. After all, the text tells us that there is a particular group of people in the city who are prospering. They are flourishing in their jobs, their health, their finances. This group has power, wealth, and standing, and as Keller put it, they are at the top. As they thrive, the entire city, including those at the bottom, celebrates. It's strange, given human nature, one could easily imagine a scenario marked by jealousy and resentment, where those at the bottom complain the rich keep getting richer and the poor keep getting poorer. Instead, the flourishing of the righteous is a cause for rejoicing, because they view their prosperity not as a means of self-enrichment or self-aggrandizement, but rather as a vehicle for blessing others. Therefore, everyone benefits from their success. Again, the verse from Proverbs 11:10, when the righteous prosper, the city rejoices. And I think today, and I don't want to embarrass Danny, but I'm going to, I think that Danny is an incredible example of this writ large. I was reading in Christianity Today's Richmond issue, which came out this month, that Danny went to UVA at the ripe age of 16, graduated from UVA when he was 19, went on to medical school, and I believe is the youngest deputy director of the health department. Okay. So one could look at Danny's life and say, wow, he could be anywhere. He is absolutely at the top of his field, incredibly bright, could probably financially afford to live anywhere in our city, and has chosen to live in the east end of Richmond and serve the poorest of the poor. So I'm just delighted and impressed to be getting to know Danny and to bring him before you. So his official bio, he is the Deputy Director of the Richmond City Health District. In addition to his role as a preventative medicine physician, he is also a board-certified pediatrician who continues to practice clinically at several area hospitals. After graduating from UVA, he attended medical school at VCU, subsequently completed his residencies at MCV Hospital and Johns Hopkins, where he received a master's in public health. He is deeply committed to the Churchill community in Richmond, where he and his wife and family have lived for the last 8 years. So, Danny Avula.
Thank you all so much. It's better? Okay. I'm really pleased to be here with you all this morning. It's been really fun to reconnect with some old faces. Audrey and I went to school together, and Andrea Kane, actually, I taught her AP biology class. Right out of college, I taught at Covington High School, and despite the fact that she was my biggest behavior management problem, actually, she was awesome.
Mine too.
Well, this morning I want to start maybe just by telling you what it is that I do, what public health is, because truth be told, I don't even think my own father knows what I do. The analogy that I often give is that as a clinician, so Sarah mentioned that I'm a pediatrician as well. So as a clinician, I see, diagnose, and treat individual patients, right? I have a kid who comes in, maybe diagnose them with pneumonia, put them on some breathing treatments and prescribe an antibiotic and treat the disease. As a public health physician, my patient is the community. So in my role in Richmond, I look at the city of Richmond as my patient, which changes the perspective. It changes the way that you look at illness, and changes the way that you look at diagnosis, and it changes the way you look at treatment. One example might be obesity. We look at obesity as a public health epidemic. It's a problem everywhere in this country. And the diagnosis of obesity really comes in community assessment, figuring out exactly what is our obesity rate, how big a problem is it, are we seeing it only in certain pockets of the city, or is it a citywide epidemic? The treatment part of obesity also becomes much more complicated, because it's not like I can just write a prescription and say, hey, take this medicine, and although you see a lot of that in magazines and on TV, it doesn't actually work that way. But I can't just write a simple prescription to treat obesity. And so the treatment of a population-level health problem looks like education initiatives. It looks like policy initiatives, thinking about ways to potentially subsidize grocers to carry fresh fruits and vegetables in inner-city communities, for example. So the treatments are much more complicated and occur on vastly different levels than my work as an individual pediatrician and clinician. So that's where I start with public health. We look at the big picture. We look at issues that affect entire communities and figure out how to address them. So given that introduction, I want a little bit of feedback, some participation from the audience here. If we think about major public health issues, obesity, cancer, diabetes, heart disease, sexually transmitted diseases, what are some of the things that we could potentially do about it, or that I might move the city to act on to address some of those issues? Not a super hard question. What are some of those?
Education.
Education, okay. So broadly, we do a lot of education. Prevention, okay. What kinds of things would we ask people, or would we want to prevent?
Well, I think with the education piece, teaching them what causes the illness or what gives you risk factors, trying to teach them how to live with those.
Okay, yeah, very good. So we do a lot of prevention work. Any other thoughts? Maybe specifically related to obesity, heart disease, smoking?
Encourage fitness.
Okay, good. Wellness, fitness, nutrition, that's a big part of what we do. That's really good.
Enable the parents to be able to do the steps that they need.
Okay.
Because that's such a struggle. It complicates their life to be able to get the fresh fruits and vegetables.
Absolutely. Yeah, that's a really good answer, and that gets a lot into what we actually do. So I found this list of kind of traditional public health approaches, and so I'd like to read it, and some of the things, exactly the things that you guys said. And this list is juxtaposed with a second list, and I'll read both of them, and we'll kind of talk about the importance of that. So, 10 traditional tips for better health. 1, don't smoke. If you can, stop. If you can't, cut down. 2, follow a balanced diet with plenty of fruit and vegetables. 3, keep physically active. 4, manage stress by, for example, talking things through and making time to relax. 5, if you drink alcohol, do so in moderation. 6, cover up in the sun and protect children from sunburn. 7, practice safer sex. 8, take up cancer screening opportunities. 9, be safe on the roads, follow the highway code. And 10, learn the first aid ABCs, airways, breathing, and circulation. So that's a pretty good summary of prevention and education efforts that really impact some of the biggest public health issues that we deal with, okay? I'm going to read a second list here, and we'll discuss how this actually may be more relevant to the work that we do here in the city. 1, don't be poor. If you can, stop. If you can't, try not to be poor for long. 2, don't have poor parents. 3, own a car. 4, don't work in a stressful, low-paid manual job. 5, don't live in damp, low-quality housing. 6, be able to afford to go on a foreign holiday and sunbathe. 7, practice not losing your job. And and don't become unemployed. 8, take up all the benefits you're entitled to. 9, don't live next to a busy major road or near a polluting factory. And 10, learn how to fill in the complex public housing benefit application forms before you become homeless and destitute. So, as I read these two lists next to each other, the first list really speaks to what we think of as public health, these major health issues that could be prevented by lifestyle changes, by better decisions, by behavior changes. The second list kind of points more towards social issues that address health outcomes. And that has become a huge part of what we look at in public health, because the reality is who you are, where you're born, where you live, what kind of family you've grown up, how much money you have. All of those things play into your health at the end of the day. And even though kind of the presentation of this in two lists of 10 is somewhat tongue-in-cheek, the fact of the matter is that these have much more of an impact on the health of the majority of the population in our city than that first list does. And so I want to talk a little bit about that, and I'll start with revisiting this first list and talking about why this is complex for a lot of the population that we serve. Follow a balanced diet with plenty of fruit and vegetables. This young lady in the back mentioned the fact that sometimes it's hard for parents to figure out what to feed their kids or how to get some of that food. And that it's a really good point. It's not as easy as saying you got to fix your diet. You have to improve, cook healthier, exercise more. Because there comes a litany of questions from that that really point to some of the core issues that our families are dealing with. Where do I get this food? Because the corner stores in my neighborhood don't carry it. How do I cook the food? Because in my culture, we don't cook that way, and this is something really new and different for me. How do I ensure that my kids will eat this food? Because it's not anything they've ever been exposed to before, and they probably won't like it. How do I afford this food? Because a lot of the food that you're telling me to eat costs a lot more. So you can see the layers of problems and complexities to what contributes to the health outcomes of a lot of the populations that we work with. Manage stress, for example, by talking things through and making time to relax. I mean, this is, while it seems kind of basic common sense, is the furthest thing from what a lot of families in poverty are thinking about, because they are stressed to the max because of a number of kids that they have, a lack of family support, a real breakdown of the family structure. They may not have the skills of actually having to manage some of those conversations and knowing what to say or how to diffuse stress. They may be working multiple jobs to keep food on the table. And so this idea of taking time to talk things through or taking time to relax may not be an option for a lot of the people that we serve in our city. So I want to talk about maybe 2 different initiatives that the health department has been involved in that kind of point to how we've looked to address some of these complex issues and social determinants. The first, there's so many different public health issues that really top the charts for a city like Richmond, for a city that's majority minority, for a city that has a very high poverty rate. And Dr. Meeser was probably here, and I think it's 22%, about 1 in 5 residents of Richmond City is under the poverty limit. And so, a lot of the things that you see in other large urban areas, teen pregnancies, infant mortality, sexually transmitted disease, all of those are also true of Richmond. Those are the same public health problems that we deal with. And so, as we, about 3 or 4 years ago, started to think through, how do we get to that? What are the issues going on there? Is it really about promoting safer sex? Is it really about making contraception more available? Is it really about getting women into prenatal care? And the answer is somewhat. I mean, some of those things are helpful and part of the answer here. But the bigger issue is that all of these tie back to a breakdown in relationship, a breakdown in the family structure. Let's take teen pregnancy, for example. A lot of people think that if we want to solve the issue of teen pregnancy, we need to educate better, we need to provide more contraception, we need to teach people how sex actually happens, and maybe provide some opportunities for them to engage in other activities so that they're not getting pregnant. The reality is that when you talk to young women in my community, that getting pregnant isn't always an accident. There are a lot of young girls who want to get pregnant for lots of different reasons. One may be that they want to keep a man around. It's a way that they can somehow maintain a relational tie to somebody. They're looking for a connection. They're looking for some sort of support, some sort of family. One that I've often heard is that they want someone to love and to be loved by. And that's really profound if you think about it, that some of these young women are coming from situations where they haven't experienced that. They haven't had the consistent family support or the consistent love or caring, and they're looking to have a baby at age 13, 14, 15 to be able to provide some of that. And so a lot of these teen pregnancies, while once were termed unintended pregnancies, we've had to revisit that language because they're not always unintended. So, that's one example of how, looking back at the root causes here, the family structure, the lack of together families, of fathers and mothers that are raising their children together, of role modeling healthy relationships, learning how to communicate and talk and work through things. All of these things are largely absent from the community that I live and we work in. And so the health department has embarked on something called the Family and Fatherhood Initiative, where we have looked to raise that issue of why is the family important. And as you guys can maybe imagine, this isn't a conversation that lots of people are excited about or really want to have. In many ways it's countercultural because our culture is going absolutely the opposite direction, right? Our culture is looking to find ways to support single mothers and find ways to make it okay for that to be a familial norm. Right now in the city of Richmond, 65% of our babies are born to single mothers, and when you start to break that down by race and look specifically at the African American population, 85% of African American children are born to single mothers. And so you see how when babies grow into children, grow into adults in family situations like this, that you enter a cycle of poverty, a generational cycle of poverty. So the Family and Fatherhood Initiative is really looking to raise that issue and to engage faith communities and how that they can invest in young men and young women to teach the basics of relationship, to maybe provide some role modeling where maybe the families aren't able to, the church is stepping into that void and stepping up to provide some of that relational counseling and training. We do a lot of work in the prisons with incarcerated men and really looking to address some of those heart issues about what we call the father wound. Men who have grown up without a father, who don't know what it is to be a father or a husband, are now entering into new relationships and addressing some of these really core issues about who they are, how they're a child of God, and how God can kind of refill that void. And I say that, you hear that out of my mouth, but also as a government agency, we've really been able to leverage the faith community to do some of this work and to really kind of promote family and fatherhood issues as a priority. And for me, as a Christian working in government, that's a tremendous joy to see how the gospel is working itself out as a result of some of the work that we in a governmental institution are doing. So that's one really exciting. There's a lot of different aspects to the Family and Fatherhood Initiative. Yes, sir?
I've got to ask a question.
Yeah.
Are you getting any heat from doing that?
Richmond is the kind of town where it's not as polarizing. Some of you may have read that Christianity Today article about the Fatherhood Initiative, and one of the things I said in there is that our mayor is an ordained Baptist minister, and there's a lot of cultural Christianity here that makes it okay to talk about God. When we get up in a state government that does become a little bit more dicey, and I think that we have really, at least we as the health department, have really approached it with integrity, and as much as we do in the faith community, we also do in the secular community. We're working in the schools in a very secular, evidence-based program to promote kind of core values like family and respect and trust. And so it's a good question. I feel like we've been able to walk that line pretty carefully and let our leaders in the faith community really kind of carry that burden, which is the smart way, governmentally, to do it. But yeah, it's an important point. The second initiative that I'd like to talk about is the resource centers. And these are satellite health clinics that I came on to this role about 3 years ago, and we mapped out our trends in the city. We kind of geographically mapped where we were seeing the most teen pregnancy, infant mortality, sexually transmitted disease. And it was really clear that there were very clearly identifiable pockets around the city. And as you guys can imagine, those pockets were places of really densely populated pockets of poverty. Many of our public housing communities, many of our low-income neighborhoods. And so what we decided to do was take health services out into those communities. And we were able to get a grant to work with Richmond Redevelopment Housing Authority, where we took vacant apartment units in 4 public housing communities and converted them to clinics. And we started just by providing clinical services. We were able to provide needed clinical care to diagnose and treat STDs and to do some chronic disease screening. And it was a way just to provide a gateway into the healthcare system for folks who weren't otherwise using it or accessing it. But the way that we went about it was that we first went to the community and said, there are health needs here, but what do you guys see as the problems? What kind of services would you like to see come to your neighborhood? What do you think the priorities of your neighbors are? How can you all help this effort and be leaders in this effort? And in that process, what has happened is that we come and provide some clinical services, but we have seen people raised up as leaders, indigenous leaders in their own community, and go out and get trained as lay health promoters through Crossover. If any of you are familiar with that program, lay people can go through a 10-week course, and it teaches you how to take blood pressure, it teaches you how to follow blood sugars, and to talk about prevention and education to your peers, to your neighbors. And so we have a cadre of peer health educators that are largely women. We have a couple men in there, but largely women in these communities who have taken the step to do this and now go and work and develop relationships in their own community and have been huge advocates for health. And our staff continually just respond to the needs that the community raise up. A few weeks ago, one of the women said, I think there's a lot of domestic violence in our community. And so Amy, my nurse who runs those centers, said, I think we can find a counselor to come in and work with that. And so, a few weeks later, they connected with Bethany Christian Services, who came in and started doing domestic violence education and counseling. And so, that's one example of 50 about ways that this model of healthcare has really empowered individuals in the community, helped people to make better decisions, and improved the health of the community. But the foundation of all of that, the type of approach and the type of work that's going on there is a relational one. It's that we didn't go in the community and say, here are the answers to your problems and this is what we're going to provide you. But that we engendered relationships with people who live in the community, sought their input, sought their leadership, and empowered them to be the advocates in their own neighborhoods. And it really has been a remarkably successful model. We've had a lot of funding from local foundations, from national foundations, and are now looking to expand the model. But where it's hard and where the balance is in trying to expand is that finding people who get that approach, who understand that it's all about relationships and forming those meaningful relationships, empowering those indigenous leaders. That's not something that's very easy to put on paper or very easy to sell to a foundation, but it's clearly bearing fruit in the work that we're doing. So, 2 brief examples of how we are really looking at these health issues not as how do we decrease sexually transmitted disease or decrease teen pregnancies, but how do we address those upstream issues of family and fatherhood and one thing I didn't mention about the work that's happening in the resource centers is that when young women come to the center and talk about their lives and, are often seeking out birth control or want to be tested for STDs. Our staff have just become masterful at walking them through a process of saying, why? Why are you engaged in this kind of behavior? What do you think the consequences of this behavior are? What's next? Do you have hope for anything, for a next step? Where do you see yourself going in the future? And asking those questions and engaging that conversation totally shifts the feel and the outcomes of a lot of those conversations. So, two brief examples of how we are doing things just a little bit differently at the health department, but think that over time this will really have a huge impact on on the health of our city. Sarah did ask me, she kindly reminded me that a lot of the people in this room aren't in the health profession and probably don't plan to be. And so she did ask me to try to make this relevant, to connect and to maybe provide some practical advice about how to do this, how to get involved. And it sounds like you've had other speakers who have addressed that in many of the same ways that I probably will address it. And kind of the practical bullet points that I can think of. We, and hopefully you've been learning this through scriptural study and through generous justice, but that I think it's clear that God uses us, right? He doesn't need us to do this work. He elects to use us as his hands and feet here on earth. And so intentionality in pursuing that, really, living out of obedience to that call and being intentional about engaging the types of relationships that I think Scripture calls us to is the first part of that. And so there are lots of ways that can happen. I mean, some of the most obvious would be, maybe going and tutoring in a community that's different from the community that you grew up in. Whether that's inner city or refugees, we have a huge refugee population in the Richmond metro region, or just people who may live in your neighborhood or surrounding neighborhoods that come from broken families or don't come from a lot of means. I do, however, think that tutoring is kind of barely scratching the surface, and I say that because what I've seen through chat, you guys heard about chat and Kate a few weeks ago, is that people get connected through an opportunity like chat or STEP over in the north side of Gilpin Court, and just want to do something good, want to maybe be intentional about being in a relationship with people that are different than themselves. Start tutoring, and a light goes off, and they see that there's way more to this, that as they enter a relationship, the whole perspective changes about how they want to be involved and engaged in the city and in the life of families like they're serving. And so I would say that tutoring is scratching the surface, but the next step would be real mentorship, and even the next step would be really true discipleship, finding people to walk alongside. To grow with, to run errands with, to show somebody how maybe your family operates, to take somebody into your life in a way that may seem awkward at first, but after you've done it once or twice, it becomes second nature. And my wife and I have done this a lot. We've had families live with us. We've had, the last 2 summers, we've had a young teenage mom and her son live with us, and have just been incredibly affected by that, both because it gives us a window into life that we wouldn't have had otherwise. She has just been so real and raw with us about the family that she came from, and some of the types of emotional and mental abuse that she's gone through, and so it's opened up a lot for Mary Kay and I. But I come back to this idea that mentorship and discipleship, intentionally done with people that are different than you, is another way to approach this. There are other practical ways. There are all kinds of nonprofits and other opportunities around the city. Urban Hope is one that I can think of that does affordable housing and looks to pair families from suburban communities or resource families with lower income families that are looking to own a house. And so it's the same kind of idea. It's this mentorship idea that you come alongside a family, you get to understand the hurts and the difficulties of their life, you lend some of the resources and knowledge that you have, often having grown up in a more privileged situation, and are able to pour into somebody's life in a meaningful way. So those are some of the just practical ways that I think it's important for us to think about it. And the key there, again, intentionality. I mean, unless we really choose to say, this is important to me, that the Bible calls us to engage the poor somehow, some way. Clearly doesn't call all of us to move into inner city communities, but it does say that we are to care about the poor. And so how do we do that? We need to be intentional about thinking about entering into relationships that stretch us. I'd like to close with the thought that, I've talked a lot about how entering those relationships is good for us because of what we can provide to people, about ways that we can serve people. It's kind of, how God uses us in people. But I will also say that can be completely flipped on its head, because I think a really important part of how God has created us and how we really find our wholeness in the way that God has created us is to be in those relationships, not only for what we can give to people, but what we learn in the process. And 2 points on that. One, I think just how God sanctifies us through really difficult relationships. I mean, all too often I think about the fact that, I'm a doctor, I'm living in the city, I'm doing all this good stuff, things are going well, and I am totally blinded to my own sin until I get into these situations where I'm in these really gritty, messy, dirty relationships with my neighbors, and I see my own sin come out, and I wonder, do I really care about the plight of my neighbor? Am I really looking out for their best interests? And so it's in those relationships that I feel like God has shown me my own sin. The second point is this, that there's mutuality in those relationships that really has grown me as a person. And I think that Mary Kay and I say all the time that our life has been far more changed by the way that we've been affected by our neighbors and the community that we live in than the impact we've been able to have. And, an easy example of that is just the radical generosity of so many of my neighbors. We live next door to this woman, Thelma, who literally, for the last 6 months has not had running water. And because she can't afford it, and, she's kind of squatting in this house of a family member. And, but, she took some money out of her check to buy a baby present for Abby when she was born. And, you just look at that and think, this is not a good use of your money, but her heart is clearly in a place of wanting to give and wanting to honor and wanting to celebrate. And so, it's times like that where I'm just blown away by a sense of love and generosity that I haven't always espoused. And so, so I think in closing, it really is about the mutuality of relationships, and I think God does an amazing work through that process. So I'll open it up to questions at this point, and we can hit any part of that, the public health work, the living in the city stuff. Yeah.
I'm wondering if you could elaborate a little bit on the whole things you said. One, the urban hope thing. I'm just curious, what does that sharing of resources look like? And what are you thinking of when you say it? Is it just, providing monetary help, or is there something else that you had in mind?
Yeah.
The other thing I'm curious about is, when you're talking about being in the grittiness of the relationships and seeing your own sin, wondering, do I really love my neighbor? I wonder if you had an example of something along those lines.
All right, I'll start with the first one. And the first question was asking about some elucidation about urban hope when we're looking for opportunities to pair families from suburban communities with inner city families who are looking to own a home. What does that relationship look like? What does that mentorship look like? Is it just money, or what are some other examples? And actually, our hope is that it's not money. Our hope is that when a family chooses to enter a relationship like that, at least, the guidelines we've tried to create is no money exchange for at least a year. And inevitably that stuff comes up, and it's really complicated and presents a power dynamic that makes the relationship awkward. And that's why, some of those guidelines are we think, healthier to follow. But the relationship really is more, in some ways really practical. Like, these families have never owned a home. They've been in generations of renters. And so things like taking care of your yard, or changing your air filters, or even having to like screw in a doorknob, are things that seem totally foreign. And so, we find a lot of practical ways that families who have done that stuff or have some knowledge of that stuff can speak into their lives. And that just becomes the opening of a door into a much deeper and more profound relationship. And what we've seen, in the situations that Mary Kay and I have been involved with, and a lot of the folks in the greater community that have been involved with families through Urban Hope, is that they begin to be let into the life stuff about what's happening with the kids and how do I manage discipline problems and I'm in this bad relationship situation. And so, the platform of housing becomes an open door into a much more meaningful relationship. So, any more on that? Okay. So the second question, anything else? Yes, sir.
You deal with the mental health issues in these little community projects?
Mental health?
Especially like depression.
Yeah.
Alcoholism.
We do. No. So the question was, do we deal with mental health in the community clinics that we run, these resource centers? We do, but nowhere near the degree that we need to. And this is a huge issue citywide, is that, when we talk about the brokenness of family and these societal structures, clearly that bears itself out in depression and all sorts of things across the mental health spectrum. And for folks who don't have means, who don't have insurance, there are not a lot of options. Here or nationwide, it's a huge gap. The way that we have attempted to meet that need is through support groups that some nonprofits or mental health agencies have offered to come and do for free for folks in the community. The others that we've gotten the Richmond Behavioral Health Authority, which is the provider of mental health services to the uninsured in Richmond. They have lent a master's trained counselor 1 day a week to see individuals counseling. But it's something, but it's scratching the surface.
Do you see any kind of direct link between this almost epidemic of teenage girls getting pregnant and some kind of depression that they fear that they won't be able to face their peers who have, quote, proven their womanhood?
That's a really good question. So he asked, can everyone hear him, or is it helpful for me to repeat the question? Repeat it, okay. He asked if we've seen depression as one of the underlying reasons that teenage girls are having babies, because they somehow feel like they won't measure up to their peers who are having babies and have proven their womanhood through that process. I guess the answer is that we at the health department haven't really looked at that specific question. It makes a lot of sense, and we see a lot of depression. And sometimes it's hard to tease out, is the depression because of that specific issue, or is it just because, life sucks in a lot of different ways, and there's lots of reasons for them to be depressed,
When I lived in the Bronx, I get these teenage girls for some reason would ask me this question: does my pocketbook work? And I'm going like, what are you talking about? And, it took me like 2 years what they really were talking about. And then a few years later, the other thing was, am I fertile? And, you try to answer it in a theoretical way. Yeah, you're a healthy, normal person, and, 90% of women have had babies.
Yeah.
And so it meant absolutely nothing. It had to be answered in the concrete.
Yeah.
And which, to me now, I would say that's some kind of depression. When you can't answer it in the abstract with self-confidence, you have to go out and prove it. And then nobody questions your womanhood.
Gotcha. Yeah.
And of course, with men, you've got a similar thing, with promiscuity.
Right. Absolutely. Yeah. Yeah. Sorry.
You sort of presented a centrist argument to poverty to takes into account both cultural, societal issues as well as addressing, I guess, kind of the Republican arguments for poverty as well as the Democratic, and being kind of a government major in college and thinking that way. And reading in Generous Justice how, Tim Keller kind of points out that poverty isn't so black and white as we make it out to be, and this being an election year. Can you answer that question in regards to like Richmond City and the way in which Richmond City is addressing poverty, and does it seem to take Tim Keller's model? Because you obviously are, I don't know if you're familiar with that, kind of argument that, poverty isn't so much an easy fix that, they just need to be taught, but they also need to be supported culturally. And I mean, that's the argument you're presenting. Yeah. But how well received do you see that within, is it Jones administration and,
quick rephrasing of the question is, how well is the current Richmond administration addressing poverty in the model that's been presented in generous justice and some of what I've talked about that's both individual but systemic as well. From the social services perspective, not very well. This whole idea of family stability and family structure, like I said, it's pretty countercultural. The social services culture over the last couple of decades has really evolved in support and train single women, provide more benefits, provide more education, provide childcare so that women can go out and get jobs. And while some of that is helpful and can be helpful, it's not the fix. I mean, we've clearly talked about and seen that there's so much more that goes into it. So, sorry, I had a hand over here. Yes, sir.
Two, if I may. Is childhood hunger a problem in the area? And second, can you reconcile for me obesity and childhood hunger? If the answer to the first question is yes.
Yes, two questions. One, is childhood hunger an issue in the area? And two, how is obesity simultaneously a problem if childhood hunger is as well? Well, it depends how you define hunger. There are multiple federally defined food deserts in the community. And it's a formula that basically says how much food is available, what's the income level of the people who live in those neighborhoods, and what's the accessibility to places that provide the breadth of nutrition. And so hunger is an issue. One easy way to point to that is that 90%, well, that's Shimarazo, system-wide in Richmond Public Schools, I think about 78% of kids are on free and reduced lunch, which means they get 2 meals a day in the school system. So maybe some of that need is being met through the schools, but it's terrible that it has to be met through the schools. And it does, belie a much deeper issue of it's not happening at homes, it's not prioritizing the family, it's not accessible to the family, and then all those other things we talked about. So yes, it's an issue. We have some bad solutions in place, and hopefully those are getting better. The second issue, why is obesity a problem if kids are hungry? And I guess it's really more of a nutrition question, is that how can you eat bad food and still be fat? And the answer is sugar-sweetened beverages. There's a huge intake of sodas, juices that are really high calorie, and so do lead to obesity, but don't lead to health. And then a lot of the meals that kids rely on there, there's no grocery store in walking distance of my neighborhood, but there are 5 corner stores in walking distance of my house. And when you go into one of the stores, I actually had one of my master's in urban planning interns do an assessment where she went to all of these corner stores and she chronicled the food that was being sold, and only one had any type of fresh produce, and it was one onion. And so, does that even count as produce? Yeah. So most of what kids are eating and sustaining themselves on is candy, chips, some canned goods. But the food that's going in is caloric, but it's not healthy. So yes, obesity is simultaneously an issue as hunger is an issue, but hunger may just be defined slightly differently than you were thinking about.
There's even stuff that seems good, but high fructose corn syrup is in everything.
In everything, yeah, it's true.
You really have to be careful not to eat that stuff.
Yeah.
One more question. So I was going to comment, about, I work in Chesterfield schools, but when we look at the children even in our school system, system that have the free introduced lunch, the quality of food that's provided for them is incredibly poor. I mean, and there's no option for them. I mean, what they get in the line, if you're on free introduced lunch, is very limited. And it's just not things that children really necessarily want to eat all the time, or, you know, the main part is usually pizza or, you know, like a grilled cheese sandwich or something that's very like carbohydrate heavy, but also fat heavy. And we were kind of wondering if you guys do any work with the school system?
Yeah. So the mayor recently established, sorry, repeat the question. She talked about her time in Chesterfield and basically the fact that school food is really bad. And are we doing any work to improve the quality of school food? So the mayor recently put together a task force called the Food Policy Task Force. One of the sub-work groups on that is school food. Kind of the lame and easy out that often gets taken is that we're dependent on the feds for that money, and you got to make that money spread pretty far away, and so you don't have many options. What we've seen some more progressive and innovative communities do is that they find ways to financially augment that budget. And Charlottesville is a great example. There's a couple schools in Charlottesville where they have spent money to upgrade kitchens to be able to actually prep food on site. And so they've made linkages with the food system where they have local producers who are bringing food into school, they're preparing food on site, and they're serving that food to their kids. And so, you know, these are things that we, for the first time really, are looking at in Richmond. And, you know, I mean, obviously the budget year isn't super favorable for this, but the fact that the conversation is happening and there is a growing momentum in the food community. You know, I don't know if you guys have been reading the paper, but there's been a lot about the Food Policy Task Force and about how people are really excited about backyard chickens. So there are just more and more voices around issues of urban agriculture, food deserts, and food needs. So I think there are changes on the horizon. What do you want, Sarah?
Kendrick, we defer to you, and then would you close things out?
I just got one question. I kind of came in late. I wasn't sure if you addressed this. You said 85% of the births in Richmond are the single mothers.
85% of African Americans born in Richmond are born to single mothers. Yeah, 65% across the board.
65%. Are you doing anything with the men, the boys,
Yeah.
particularly?
Yeah.
Because it seems, I mean, they're not getting pregnant from walking.
Yeah, the question is, what are we doing about the boys? And I don't know if you heard me talk much about the Family Fatherhood Initiative, but so a lot of that work is really focused on faith communities mentoring young men in their congregations and reaching out, and also working in the jails to work with juvenile justice and the Richmond City Jail to find incarcerated men. But yeah, you know, Brian Gullins, you guys would not have met him. He came and spoke to RCLI in this room, which is why I had to do a double take. But Brian leads our Family and Fatherhood Initiative. He's an African American pastor in town. He's you know, really made some great inroads with the faith community here. But I'm glad you bring it up because it's a huge, historically has been a huge gap and is very much an area of focus for us now.
You know, I bring it up because relationships with women kind of work easy. Relationship with men, upsell.
Yeah.
And I wasn't hearing anything about it.
There aren't any governments who are really excited about funding that either. I mean, it's a big problem about you know, how do we shift the perspective of you know the leaders and decision makers of our country.
Wow, Deanna.